Welcome to the wound bed preparation and wound cleansing in practice video. Through recent advances in science, we have an improved understanding of wound healing, the importance of wound bed preparation, and the role effective wound cleansing plays in the healing process. In this video, we will demonstrate how to effectively assess a wound, prepare, and perform effective wound cleansing. Wound cleansing is the process of removing loose tissue and debris from the wound bed to create the optimum wound healing environment. Wound cleansing should always be performed well before choosing an appropriate dressing. Also, before wound bed preparation and cleansing is performed, a holistic patient assessment should be undertaken that really considers the person's medical conditions, current medications, and any social factors. These may impact wound healing progression. Pain and patient discomfort should always be monitored and managed during the wound cleansing process. Following a holistic patient assessment, a wound assessment is then undertaken. Here we ensure that the wound is measured and the characteristics of the wound bed and peri-wound are determined, including any tunnelling or undermining of the wound edges. Wound details should then be recorded in the notes. This can be achieved through a systematic approach, such as using mnemonics, and there are many around. One specific one would be the MOIST concept. When assessing the wound, consider, what phase of healing is this? What is the colour of the wound bed? Is it pink, red, yellow, or black? Is there any green? Think about odour. And what's the exudate like? What colour is it? What's the viscosity? And how much is there? Is there any pain? That also needs to be considered, particularly for those who may be diabetic. Do they have any neuropathy? And then we can assess the wound edge appearance. Is it level? Is it rolled? Is there any undermining or surrounding the wound? Is there a callus? Hyperkeratosis is really important to consider as well. Is there any dry macerated areas, erythema or edema? When assessing the wound, it is important to assess the tissue type in the wound so that we can ensure that we are using the correct solutions. In this example, I'm using a simulated wound model. In this wound bed, we can see that we have some red, healthy granulation tissue, some gelatinous slough, and some more tenacious slough, as well as some necrotic tissue. To effectively clean this wound, I'm going to need a clean area. In this case, I'm using a bluey. Dressing products, cleansing agents, a dressing pack, gloves, hand gel, and potentially a wound swab. If there are signs of infection, you may want to consider taking a swab. However, we must always think about antimicrobial stewardship. In the same token, think about the best technique for taking the swab. In this case, the gold standard is the Levine technique. We also need to wash our hands, don our gloves, and consider, do we have the appropriate dressing pack, ensuring that we have a sterile field. So today I'm using Granudacyn wound cleansing solution. It contains a hypochlorous acid and sodium hypochlorite. I have chosen Granudacyn because it is tough on pathogens, but compatible with human cells. In addition, Granudacyn quickly facilitates the mechanical removal of microorganisms and cell debris. There is no need for soaking. However, if the wound tissue is crusty, then you may want to consider a soak. Hypochlorous acid is effective in disrupting bioburden and also aiding debridement. Granudacyn can be applied to all wound types, including chronic, acute, and complex wounds, and it is non-cytotoxic. Granudacyn is pH neutral and is non-irritating to the wound and fragile surrounding skin. The most pivotal part of setting up a wound bed for success is how you actually cleanse the peri-wound as well. The wound bed to remove unwanted material is so important to promote a healthy environment. Cleansing should include approximately 20 centimetres outside the actual wound edges. The next tip is to ensure that debridement, when needed, is performed as per your local policy. Generally speaking, all clinicians are able to use mechanical debridement as an option. We will now demonstrate cleaning a wound using the gauze swab technique. I'm going to demonstrate this by using the non-touch technique. First, I'm going to moisten some gauze using the Granudacyn solution. I will then gently clean my wound bed. To do this, it's important to go from the inside out so that you're not cross-contaminating that wound. The gelatinous slough in this wound requires some increased force. My goal is to pick up and mechanically remove the gelatinous slough. For necrotic tissue, it is so important to determine what type of debridement is needed. Can I achieve this using mechanical debridement, or do I need to consider sharp debridement with someone experienced in debriding? If debridement is being considered at the bedside, we really do need to think about our local policies and procedures and what other considerations are required. If you have a cavity wound with thick, tenacious slough, you may opt to use the Granudacyn by soaking the gauze and applying it to the wound. So to soak the wound, I've applied some gauze to the cavity. I'll now drench the product over the top using the Granudacyn product and allow it to sit there for whatever time is required based on your clinical judgment. If you have a necrotic area that is soft and boggy and you believe by good hydration you could lift that area, you could consider other products such as a wound gel. In this case, Granudacyn wound gel may be an option for you. It is easy to apply and all you need to do is spray the area. Once applied, it does form a gel. Following wound bed preparation and cleaning, the wound bed needs to be reassessed for the tissue type. If the wound bed is deep, such as a cavity or tunnelling, or if there's any moderate to high amounts of exudate, the wound bed will need to be packed with a gelling fibre dressing. Today I'm using extra fibre, or if the wound is showing signs of infection, you may want to have a consideration for an antimicrobial dressing such as extra fibre AG+. To fill a cavity wound, you need to select the right size of extra fibre and then pack it loosely into the cavity, and don't forget to ensure that you cover all areas including any undermining. It's also important, if you are using the ribbon, to allow a tail of at least 2 to 3 centimetres outside of that area. For shallower wounds, choose the correct size of dressing to be able to cover the entire wound, and for best results, extra fibre should always overlap the edge by at least 1 to 2 centimetres, and then apply the extra fibre dry to the wound bed. When choosing the dressing to cover the wound, it is important to choose a dressing that minimises pain upon application and removal. Effectively absorbs exudate is very important, and you need to consider the comfort for the patient. And how long is the wear time? Up to 7 days is wonderful because it provides undisturbed wound healing. Today I'm using Mepilex Border Sacrum. Now it's time to document what you've achieved, your assessment and your goals for the patient as per your organisation's policy. Thank you for watching. To summarise, I've demonstrated how to effectively prepare, cleanse and dress a wound using gentle techniques and products.